Good afternoon, Unite for Her community. Happy Thursday.
Yeah, good afternoon, everybody. Erin, weren't we just here? I feel like we were just here.
I'm
Less than
having deja
24
vu.
hours. We have a busy November.
I know, but it's so good to be back. So, welcome to our second Ask the Experts of November. And we are bringing you another really great topic. And ironically so, again, in that breast imaging space. So, we are so excited to have two amazing experts with Bexa Breast Imaging to dive a little bit more into that. So, we're really excited for today's Ask the Experts.
Yeah, we have the honor of having Tiara Neal here and Dr. Monique Gary, both no strangers to Unite for Her. I have always the privilege of seeing them across the nation. We run in the same circles, but I'm very excited to share all of this information that we can about the Bexa Equity Alliance and all that they are bringing to the table as a complement to our type of testing. So, also good, Erin. We've been waiting for this one. I feel like we've been waiting for this one,
Been a
and so
long
glad
time
that we were able to
coming.
get everybody in the at the right time.
Absolutely. Yeah. So hopefully you are watching live on Facebook. We did receive a few questions from our community, but know that if you are listening in, please submit your questions live on Facebook. We're monitoring that chat as well. So we'll be answering questions live as they come in, and we'll get through as much as we can. If you know of someone that might be interested in learning a little bit more about this topic, we are recording. It will be in our Her library, so know that you can always tune back in and rewatch it or even give it another listen.
Perfect. And Erin, we always forget to introduce ourselves, so I think we should do that. I am
I
Sue
know.
Weldon. I am the CEO and founder of Unite for Her, 20-year survivor as well. And I'm here with my colleague, Erin Pellegrin, who is our Senior Director of Education and Culinary Nutrition and leads our education platforms. We also are so honored to have this platform, 41 total live events that we do a year, and we can't do them without the support of our education sponsors. And they are truly, truly the foundation to how we're able to deliver this month after month. So a big shout out for our presenting sponsor, West, Merck, and Daiichi Sankyo, with additional support from Lilly, GSK, Gilead Sciences, Pfizer, and Immunogen, which is now a part of AbbVie. Again, we are most grateful, and we are bringing all of this live to you because of their generous support.
Wonderful. And looking forward to a continued exciting month ahead for November. So, just a little teaser for what we have coming up next week. So, no, almost every week this month, we are bringing you a new educational segment. So, next Thursday, November 14th at 6 p.m., we have our Her Speaker Series. So, we will be joined by one of our Unite for Her providers, licensed professional counselor, Cassandra Bolding. She is doing a presentation on Black women with breast cancer, focusing on the societal pressures and stressors that they uniquely experience and how to best work through those experiences. So we are so thrilled to have her back. Cassandra has brought us really wonderful discussions and presentations in the past, and this is just adding to that list. So be sure to register for that event. We will pop that link in the chat for you. Of course, again, if you're not able to join us next week, that too will be recorded. So you can always tune back in and watch that from Her library.
Yeah, perfect. And Cassandra's one of our providers too. So all of those that have an active passport, you can use her services through your passport. So I always like to mention that as well.
Absolutely.
All right, are we ready for our experts for today?
I'm excited. Absolutely. Let's do it.
All right, let's bring in Tiara first. So Tiara Neal is the founding executive director of the Bexa Equity Alliance. The Bexa Equity Alliance focuses on providing life-saving early breast cancer detection to women of color and underserved women, and it's a direct result of Tiara's personal journey. As a woman of color and cancer survivor, Tiara is a living example of the rising incidence of breast cancer among young women of color, as well as the challenges that millions of women across the world face in accessing quality early breast cancer detection. Tiara, welcome. Welcome to our Ask the Experts.
Thank you. Thank you both for having me. We've been trying to connect and be able to have this platform together. So we finally did it. I'm really excited to be here to share the work of the Bexa Equity Alliance and to really just spread the word that, we are helping to save women's lives. So thank you so much for having me today.
Oh, you got it. Our pleasure. And next we have Dr. Monique Gary, not a stranger to the Unite for Her. Dr. Mo is a breast surgeon, educator, advocate for wellness. Dr. Gary currently serves as a medical director of the Grandview Health Penn Cancer Network Cancer Program, where she also serves as the director of the breast program. She is also the chief medical officer for Bexa and the co-chair of the Bexa Equity Alliance. Beyond her surgical work, Dr. Gary is also building a movement to achieve true health equity and help communities develop holistic and integrative approaches to cancer care and wellness. She is the CEO of Still Rice Farm, a beautiful 40-acre farm that was founding as a living, learning laboratory for cancer patients and under-resourced, marginalized community. So please join me in welcoming our expert today, Dr. Monique Gary. Hi there, Dr. Mo.
Hey, thanks for having me. It's so nice to be here. Good to see everybody. I always love these segments, so it's really exciting to actually be a part of one of them, and I'm very grateful.
Well, we're grateful to have you both. And like Tiara had said, this has been a little bit in the making, but all good things come to those who wait, right?
Exactly.
Indeed.
All right. So, Dr. Gary, let's start with you. We're going to dive in here. And can you please explain to us what Bexa is and how it works?
I can. I wonder if we shouldn't start with understanding why it's necessary.
Oh,
Can we back
absolutely.
up a
Take
little
us.
bit? All right, so
Absolutely. Yeah.
let's backtrack a little bit and let me take you to a survey that Hologic just completed this year, right? Earlier this year, I think it came out in July, that there is, have you heard of what's called the screening gap? The screening and detection gap, but there's the screening action gap essentially refers to the number of women who know they should be screened. They know what they need to do, or they have an idea of what they need to do, but for whatever reason, they're just not doing it. And so Hologic did this survey of over 4,000 women in the US, and they found that while 90% of the people knew that regular screenings are important, this is women, only 40% admitted to postponing or skipping altogether, right? And the reasons that they did this, well, we got to go there because some of them said, well, we're confident in our knowledge about what we should get. 20% said they had no time. 60% said it's difficult to make their health a priority, right? Which went up to 75% of people who had children. And combined, about 40% of the people surveyed said that they're worried about anxiety, about pain, about discomfort, about radiation. All of these things are the reasons why women who have insurance, who have access, don't necessarily utilize that access or that insurance to get the screenings that they need. And so there is this gap, not only in the early detection for people who don't utilize routine and annual screening mammography, but there's a gap for people who do and have dense breasts. And they're maybe told they need supplemental imaging, but they don't know what that means. Their insurance may not cover it. There's a gap for people who are too young for screening, right? But we know cancer doesn't start at 40 just because screening starts at 40. And so it begs the question, well, how come that starts at 40? And it went up to 50 and then went back down to 40? And it's because of the type of technology that's utilized. So mammograms are a type of camera, right? It essentially takes a photograph of the breast. It is an X-ray. It's been around since the 1960s, but there are other types of cameras for the breast. Ultrasound takes a picture of a breast, looks at the consistency, at the fluid consistency, and looks for masses. MRI looks at magnetic waves through the breast and looks to figure out areas of enhancement where there's increased blood flow that might suggest something's growing. So elastography, which is the technology that Bexa utilizes, is a type of camera also. All right. So you got your Polaroid, you got your Kodak, you got your iPhone, you got your Samsung. So there's different ways of looking at the breast tissue. And it's based upon the principle that all breast tissue and all normal tissues are going to have some elasticity, stretchiness. I have a slide here and I have a picture of the princess and the pea and the lady laying on the mattress and then there's a little pea at the bottom, right? So those mattresses are squishy. But if something is in there that's stiffer or harder, the technology will detect that. And so all abnormal tissue, something that's potentially cancer, is going to be 100 to 1,000 times stiffer than the normal tissue. So think sponge. It's spongy, spongy, spongy. If there's an olive pit in that sponge, it's going to push back on the tissues. The tissue around it is going to be stiffer relative to the elastic or the squishy tissue. And so this is the principle on how elastography or tactile imaging is. It's a form of what we call tactile imaging. It is FDA cleared. It's a class 2B device. It has been around, surprisingly, Sue, since, oh gosh, elastography was first discovered in the 80s for liver. And it was utilized because liver is a very spongy type of tissue to find liver cancers. And it had never been,
telling me that.
right.
I remember hearing it's been used as technology that we actually have been using.
Yeah, and but it had never been really refined or high enough resolution for breast. It hadn't been handheld. Like you can't use a big giant machine and compress the breast. Oh wait, we already do that. We do that with mammograms, right? We use a big giant machine and we compress. But this looks at the squishiness of the breast. And so a Harvard robotics engineer actually engineered this technology and took the existing device that was available in the early 2000s and put his sensors into it and said, well, I should be able to create something that almost acts as fingers that rolls across the breast. And so on the bottom of the Bexa device, there's 192 sensors that all feed back at about 8,000 times a second. And so you're getting this massive amount of information regarding the squishiness or the elasticity of the breast. So where there's a mass, the elasticity drops, the stiffness goes up, and it generates a peak on the screen. So it finds breast masses really, really well. And that is the best and easiest way to understand what it does. Now, I'll pull up a quick slide just to give people who may not have seen it before a chance to sort of see what I mean by that. And let's see. Can you see this?
Yep, you got it up full screen.
Awesome. You can see my slide, right? And what I'm going to do is try to go full screen here and show you exactly what I mean. So this is the Bexa device. And on the bottom of this sensor are 192 sensors with 2 filament sheets dividing it. And as it rolls across the breast, it generates what's essentially a topographical map of the breast. And where there's a lump, there's a peak, there's a mountain, and it shows up as a green circle. And so from there, we're able to locate where masses are in the breast. And as I was saying before, this is the basis for how this tactile imaging works, right? Squishy, 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 something's harder and it feeds back. And depending upon the sensitivity of the camera at the top, that's how you're able to find it. And so for us, you know, once we find a mass, that's great. You found a mass, but then what do you do? And so Bexa is a process. It not only finds the mass, but it now localizes and it tells us what the mass is. Is it solid? Is it cystic? Is it something suspicious? And so that gets done immediately. And so the appeal for this and the commercial deployment for this is that we go to the workplace. We go to where women are and we help to find those masses. We find them immediately. We characterize them immediately. It is read by a radiologist and every woman leaves with a radiology report that her doctor can then understand. And so that's a really important part of this also is that, you know, I've got patients who do thermography and other types of, you know, breast imaging that are less sensitive, but also those reports are not as easy for clinicians to understand. Same thing with like QT imaging and, so, you know, certain other newer modalities. With Bexa, you leave with a BI-RADS report, an ultrasound that's read by a radiologist, and every doctor knows how to interpret that and then knows what to do next. So it's a way of, rather than comparing with mammography, we don't believe that women should stop getting mammograms, but for the women who won't, the women who don't, the women who can't, the women who don't have access, like in Uganda, where there's 4 million people and 2 machines, there should be something better than this. And that's the basis for the company and for why it's not only our mission, but our moral imperative that we help to spread additional innovation in early detection.
Yeah, and let's say that again. We are not, Bexa is not looking to replace the mammogram. It is looking to be a
Never
complement.
will. Yeah,
Looking to be a
absolutely. It
complement.
never ever
Why
will.
not have more resources? Why not have more, you know, access, right?
Well, and in 2024, we should. I mean, you know, mammograms have been around since the 60s, and we continue to ignore one of the key areas and the issues with it is not the technology itself. The technology is fine, and now we've added AI to it, and I think that's great. And so, you know, patients will ask me, well, should I pay the extra $70 to get AI to read my mammogram? And we talk about it, and now there's contrast enhanced mammograms. But
Yeah,
the issue is
heard
people
about that.
don't like
Yeah.
mammograms. Right? So you continue to optimize a technology that only 40 to 50%, maybe 60% of people are doing. But what about the other 40%? What can we offer them that's technology assisted? And why are we not thinking about that? And so we are thinking about that, and lots of people are thinking about that. And so it's nice to be a part of a movement, I think, in early detection that's not only imaging based, but there's liquid biopsies and there's all sorts of different ways of trying to find cancers earlier and earlier. And so that movement is only going to continue. So for people who are like, I don't know about this, oh, it's coming. It's coming
Yeah.
down your block. It's coming to your house. It's coming in the mail. There's a litmus test you can put in your eyes, and you can find your cancer in tear fluid. Like it's happening everywhere.
Oh, it's good news. That's good news, right?
I think
Dr.
so.
Mel, can you tell me who performs the exams and what's the training required for that Bexa examiner?
Sure. So all Bexa exams are performed by our own employed, our ARDMS certified ultrasound technicians here in the US, meaning you have had to go through allied health training, you had to go through an ultrasound program, you have to be certified to use ultrasound. One, because the device is handheld and it operates similarly to an ultrasound, although it is not an ultrasound. But two, we want technicians who are able to perform an ultrasound immediately. And that's part of the strength of the program because it really is a process. It's not just one modality, but we have figured out a way to get women who do this, 97 to 98% of them say, I would do this again. And
Yeah.
that's the hook, right? So it becomes a process. We do risk scoring, we do the Bexa exam, we do the ultrasound as done by a technician and read by a radiologist, and it all gets packaged together into results that are delivered personally to somebody. And so that's the other part of this. You're not going to open up your portal and find it and read it in an email or get a ping on your phone. You're going to actually talk to somebody and get a result and find out what you need to do next based upon that.
Yeah, can you go through the risk scoring too? You said you also get that done because I've heard so much about know your rate of risk, right? Know your
It's
family
true.
history.
So what we've done is we've licensed and created a product based upon the Tyrer-Cuzick model, which many of you have heard about. If you've read any of Olivia Munn's story, you know that there are ways to calculate one's lifetime risk, right? And so you get that calculation, but then what do you do? Many
Yes.
people will go to their doctors. I run a high risk program here at Grandview, and you know, the women who get the MRIs, that's fantastic. Some of them will, some of them won't. Some of them are still paying for either the deductible or the copay or the cost of that MRI from previous years, or they got nauseous in the machine and they feel like they're reluctant to do that study again. And so for us, you know, identifying risk is important because it helps people to know where they fall in that category and how often they should be screened. So that tool is actually going to be starting in January, and it's going to be part of our software system so that every woman who gets a Bexa exam has the option of knowing her risk and getting really the most comprehensive risk score that's available in the market.
That's good. Now, can you tell me who is eligible for that Bexa Breast exam?
So in the US, Bexa is deployed to commercially insured, self-insured employers. It's a benefit. So our customers include like Pepsi Company, and I was just in Houston at the Aldine Independent School District where there's 8,000 lives, and you know we go basically to where women are into their workplaces. We've been to Dallas Fort Worth to the airport. I was in Colombia 2 weeks ago, and we were doing exams at the airport on employees. So it is an employee benefit, so that way you can take your 30-minute break, and the exam takes 30 minutes. It's a heated massage table. It's warm gel. It's a technician who's going over your breast exam with you. And women always remark that they feel like they leave knowing their breasts a little bit better because you've got somebody at point of care. You can say, you know what, I always feel this thing over here. And you can run that device and you can do that ultrasound and you can identify, oh, this is your dense breast tissue. And so there's this really collaborative environment that happens inside that room when you get a Bexa exam. But, you know, our Equity Alliance is something that I want to bring Tiara into the conversation because until Bexa is covered by all insurances and until it's covered by really CMS, we're not going to see the equity that we hope to have. And so having our Equity Alliance is a way of making sure that under-resourced communities are able to access this technology because it shouldn't just be for folks who have great jobs and great insurance. And we've been very thoughtful about that and making sure that we provide access to individuals who are in under-resourced communities and who have really the disproportionate burden of disease and lower screening rates, lower referral rates, and younger women with breast cancer. So I'll let Tiara talk about that stuff.
Yeah, wonderful. Thanks, Tiara. And even, you know, having you here now, Tiara, I just remember being remarkably surprised about the size of the actual device. I don't know if everybody understood that on your slides there, Dr. Mo, on how, yes, thank you. I wanted everybody to see what that size looks like, how it works. Those sensors that Dr. Mo talked about are on the underneath side of that. It's like a mouse, right? Going over that breast area. And that's what just, you know, that ability to have something that's not painful, that's not, it's evolved. It's evolved to be something that is very similar to the actual type of technology that we find in our iPhones, and it makes sense. So when we're talking about, like Dr. Mo was saying, they're a part of your wellness benefits or your benefits, your medical benefits that you could possibly have through your employer. Could you dive into that a little bit deeper? Like, could we, as an employee of of a company, ask for this type of resource to come to our office?
Sorry, is that one? That one's for me?
I was going to give it to Tiara. Yeah.
Oh,
Okay.
sorry.
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 Go for it.
Yeah, so essentially, if you work for a company, you have the ability to go and reach out to your HR and ask them to connect with Bexa so that Bexa can become an employee benefit. And essentially, that's how you get access to this exam from a commercial standpoint. And we really encourage women to advocate and ask, reach out to your HR, say, hey, are you familiar with Bexa? If not, can we get familiar with Bexa and can we explore this as an employee benefit?
Great. Great. And then can you tell me, are you in any of the hospitals right now, Tiara? Because I remember, one step at a time. And I do remember, I believe in Texas that you were moving into a hospital facility.
So currently, from a Bexa Equity Alliance standpoint, we are partnered with a federally qualified health center called HHM Health in Dallas, Texas. They have about 5 or 6 locations. Speaking of which, we're excited. We have about 6 exam days scheduled towards the end of this year. So next week we'll be at HHM Vickery Health, and then the following week we'll be there for 2 days, and then in December we'll be at their women's clinic in South Dallas. So what I love about HHM Health is that they get it, and the women, it's a very diverse group of women that go there, ranging from ages 20 to 90 years old, and they're able to go there, they get their mammogram, they get their Bexa exam, and they leave there knowing that they've gotten into early detection, and that if they have dense breast, they know that they've been covered as far as getting a Bexa exam. We have 100% adoption rate. We have survey results, which is really important to us because we want women to have a voice and to be able to speak about their experience in getting their Bexa exams. And across the board, not just at HHM Health, but across the board, through our survey results, we have 100% women who say if given the opportunity, they would get a Bexa exam again next year.
Yeah. And the fact you did say, again, it was complementing the mammogram that was in the hospital.
Yeah.
So you came in as this collaborative approach, this complementary approach, very similar to Unite for Her when we come into hospital and partner and we bring integrative care to help them do better on treatment and to give them more tools. You're working together. And that is just so good to see that they are doing that and moving in that direction. Of course, the gold standard I would think you would want to see with a lot of our hospitals.
And
Dr. Oh, go ahead.
I'll jump in on that point and say that it does take time. I can remember, when Unite for Her first started and talking to clinicians who were like, well, why do we need this? Right? Oh, well, we offer nutrition support. We have a nutritionist in our hospital, but not understanding that there's a robustness that can be found through partnership with Unite for Her, right? That there is good data that supports the benefit of integrative wellness to help people get on treatment, stay on treatment, make it through their radiation, have better energy, have better outcomes. And so I think as people, start to recognize some of that, and as we generate more data in this regard, it makes it easier to collaborate with health systems. And again, we're an expansive technology. We're not like not disruptive in a sense. Like we want to get more women into some form of early detection. So the goal is to find all those people who are out there floating and they're at the Walmarts in Delaware where the rad nets are, and they're the shopping carts, and they're looking right at the mammo and going right by and buying their their lunch meat or whatever. Like, how do we get those people who aren't going into a hospital, right? Who aren't going to go into an imaging center, because those people far outnumber the people that do, and we got to offer them something. So this is an expansive technology and an opportunity to help get those people that have something found into a diagnostic pathway, and it's a way of triaging them. So that's kind of how I look at it,
Yeah. A little bit about that diagnostic pathway too, and just how to get the results. So if we back up a little bit, you get your exam, it's in a very, controlled environment. You have this trained technician that is giving the exam. And then let's see that, what is that next step if they see this mass that it picks up? How does the next step go with even their own hospital or their own doctors that are in their network?
So the way it works is that, the referral rate from a Bexa exam, because it's screening, right? So unaffected people, the majority of people aren't going to have anything. And Bexa picks up the smallest and most clinically significant things, so that there's only a small percentage of people from the general population that need to be called with their results. So let's say 7% of people are going to end up needing ultrasound. Of those 7%, maybe 3% are going to have something that needs to be followed up on. And so when that happens, there's a clinical team that I run who calls these clients. They're not patients, right? They're clients, they're consumers. We call them and we say, listen, you had an ultrasound. It was read by our independent radiologist, and they're recommending 6-month follow-up for this. They're recommending that you go to see your doctor and get a breast exam. The imaging suggests that this is what you need. Who's your gynecologist? Who's your PCP? Have you seen a breast surgeon for this? You've got family history. And so there's a conversation that then happens to help that woman understand what she needs next. And then we send those slides, we send that document, we send the report, et cetera, and they're able to follow up with their clinicians. And if they have trouble finding one, well, it's a small breast world after all, and we're able to pick up the phone and call gynecologists, PCPs, breast surgeons, and make sure that people are connected to the folks that they need to see. So we can call navigators at hospitals and breast centers, for example. So it hasn't had to happen much. Most times people have their gynecologist and they're like, you know what, I was going anyway. This is good because I know I need to ask about this now. But it helps people know what they need to do next. So you get a direct phone call and then you get your results.
Yeah, it's so comprehensive, and you're bringing in every part of the care plan team and bringing in their own doctors that they are comfortable with. But you're saying, hey, let's bring them in. Let me call them. Let me bring them into the conversation. You're not over here on an island saying, this is what we found. You're actually bringing in the whole team to make sure they get the best care. And I did, when Tiara walked me through that whole process, I just thought that was so wonderful for me, knowing I have a daughter that needs to get started to get screening early because of my diagnosis at 39. It just makes me feel so relieved that she has something like this that she could start doing every year, every 6 months, as needed, and align with her medical community that she's a young woman, so she doesn't quite have a medical community yet, right? So, but eventually, right, she can align that. So, just really wonderful. Now the efficacy of Bexa, you touched on a little bit. Can we talk about some data numbers, Dr. Mo, Tiara? That I've heard some of them. I'd love for you to share that.
We can. So the data supporting Bexa says that the sensitivity of mass detection is anywhere from 83 to 92% down to 5 millimeters. And that data came initially from a breast surgeon. You might know NCBC, a National Consortium of Breast Centers. One of their past presidents, Dr. Carrie Kaufman's a friend of mine out in Seattle. And Carrie did the due diligence on this device when it was by a different name. He published some papers, and I've got some slides and things and data that I could show you, but really documenting the sensitivity of Bexa down to fine masses down to 5 millimeters. And that's been demonstrated in a couple different settings. So certainly in his own institutional experience, it was presented back in 2014 at San Antonio, because you have to understand that COVID kind of put a bit of a stymie on small startups. So this was a startup that when COVID hit, a lot of the work that was being done really had to be halted because we told people to shelter at home. And then as they resume their imaging and resume their early detection and their prevention, now we're able to pick up again and to do more clinical trials and things. The second study came out of George Washington University, and it looked at, this was back in 2020. Rebecca Kaltman was one of the principal investigators. And it found again that the sensitivity and specificity of Bexa to fine mass is 89 to 95%. And this was actually somewhat higher than mammography. And again, it's not to compare the two, but people will say, well, how does it compare? And so there's some good studies that do show that. And we're also participating now in an ongoing study with Texas Tech. So when you ask about health systems, we're down in Abilene, Texas right now doing a clinical trial, again, comparing the sensitivity and specificity of our process with mammography so that we can generate some more data on younger women, on women with dense breasts, and really comprehensively catalog this. So we're very interested in partners and finding clinicians who want to do these trials, because beyond defining the mass, which is what Bexa does extremely well, we want to then, go into how well it finds some of the more difficult to find cancers, like the one my grandmother had, invasive lobular carcinomas that don't show up on mammograms all the time and didn't show up on hers, and bilaterally. Triple negative breast cancers, which we see a lot of young Black women who get this and they go and get an ultrasound and it looks round, it looks cystic. But the stiffness, the elasticity of a triple negative breast cancer is different. And so there's opportunities for really fun and interesting and necessary academic partnerships. So we're definitely interested in that. But the data for this goes back into, I think, 2006.
Oh, good. Good. And then I'm thinking that on the website, would we be able to get in on your website there and just see a lot of this data, see a lot of the information that you're sharing with us today? Can we pop something in the chat for our community?
Yeah. Yeah, you should be able to go to our mybexa.com site, and then for clinicians, we have like a clinical packet of information, study data, things like that we could email to folks. So sure.
Perfect. Perfect. Tara, I remember meeting you, and you just had this light about you, and I met you not only at SABCS, but then at a family wedding event. And what inspired you to take on this role as executive director? I mean, I can see it. I can see the passion and what drives you, and we need somebody like you as an executive director of this new mission that's out there. What inspired you to take this on?
Yes, Sue. I greatly appreciate that. As I shared with you, but for the community, I am a breast cancer survivor. I was diagnosed at 33, no family history. I'm the youngest of five. Both of my parents are alive and thriving in their 70s. I was not a candidate to have breast cancer in my eyes. Healthy as can be, juice cleanses once a month. Son's 4 years old. Thought I was just living my best life, and come to find out, I had stage 1 invasive ductal carcinoma, and I had to find my breast cancer myself, because after going to see my gynecologist and asking for a clinical breast exam and getting turned away, I realized when I was diagnosed 6 months later with stage 1 invasive ductal carcinoma that there is the disparities that lie in this area are glaring. And as a Black woman who had Cadillac insurance, who asked for a clinical breast exam, who was told too young, healthy, no family history, not to worry, and then being diagnosed with breast cancer, I understood the importance of advocacy and advocating for women who look like me, women who are under the age of 40. And so essentially, I joined Bexa as an advisor, and understanding and being thoughtful and understanding what the importance of providing early detection for women of color, women who don't have access. Fast forward, the CEO of Bexa, Dr. Joe Peterson, and myself, we co-founded the Bexa Equity Alliance to ensure that underserved, under-resourced communities, women of color have access to this innovation in every way possible through our partners and our allies, our corporate donors, corporate sponsors. That is how we get this work done. And we go and meet the women where they are through churches, federally qualified health centers, community centers. We partner with local organizations and I think we have, 46 partners and local organizations that we partner with throughout the U.S. We have a partnership with the Laura Bush Institute, where we have a program going on right now, where we are 3 to 4 days a week in West Texas providing free breast exams to rural populations. We also have a partnership with an organization in Freeport, Grand Bahama, which is critical to that community. We've actually found to date, we've only been there since February, and we have 2 to 3 known cancers that we've identified through the Bexa exam. And that is important information, knowing that we've only been there since February. And from what we know, 2 to 3 breast cancers have been identified through a Bexa, through women who were not getting their mammograms, who didn't have access to a mammogram. So these women are extremely grateful to us, because had we not gone to, Freeport, Grand Bahama to be able to provide these breast exams, they might not have been able to find their breast cancer until it was too late. So both of them actually are stage 2 triple negative breast cancer. So the work that we're doing, the Bexa Equity Alliance, is critical to women of color and under-resourced and underserved communities. And it's truly a testament to Bexa and their thoughtfulness in ensuring that all women can have access to these breast exams.
Oh, nice. Thank you. What strategies are you now using? Because I would assume you're trying to get it from a lot of different ways, right? It's not just one magic bullet. It's not just going into the companies. It's not just trying to find a new hospital partner. Just to engage those underrepresented and marginalized communities, ensure that their voices are heard and their needs are met. I would imagine that you have a lot of different ways that you're attacking those strategies.
Oh boy.
Yeah. Oh, go ahead, Bill.
You go ahead. No, after you. I'll chime in on the back end on the global side of things. Go for it.
Yes, absolutely. I think starting number one with sharing my own story, because when people hear my story and they know that I was 33, that I had no family history, that I'm a young Black woman that had access to everything and anything I possibly could have needed when it comes to healthcare, it shocks them, and it shocks, you know, my community, the communities in which I serve. And by being able to share my story, it encourages women, younger women, women of color, to say, you know what, I want to get into early detection. I want to learn more about my breast health history. I want to sit at the dinner table and I want to have those conversations, because if it can happen to you, then it can happen to me. So by being able to share my story and encouraging other women who are diagnosed younger, especially that look like me, we are able to advocate and to encourage women to get involved and to really spread the awareness. And that opens up lots of doors to different organizations wanting to partner. When I tell you that the Bexa Equity Alliance, and I know this sounds silly, but we're in high demand. Women who want
Doesn't surprise me. That does not surprise me.
no,
I'm your
women
number one fan. Every
Oh,
speaking
thank
engagement I go to, I'm like, you need to have them come. That
Yeah.
needs to be a part of this women's retreat, right?
Yeah.
It's such a good investment for your employees. It's usually at a corporate level that I'm speaking. So
Yeah.
it doesn't surprise me, Tiara.
Yes, and to be honest, a word of mouth, you know, by being able to provide these exams to communities, you know, Houston, Dallas, Center for Haitian Studies in Little Haiti, Miami, the DC area, South Central Los Angeles, where when we go into these communities, we truly are putting health equity into action. And the communities in which we're serving, they feel that, they know that, they spread the word. They're getting on their phone and they're, you know, they're asking, you know, their aunts and their cousins, listen, get down to the church. You know, Bexa Equity Alliance is here providing these amazing breast exams. And the beauty of it is, Sue, is that these are women who traditionally are not getting into early detection. So not only are they getting into early detection, but we're actually encouraging them to get their mammograms. So, hey, having that conversation and eliminating that fear that they've always had, because the community talks and they listen. If someone in my community said, I'm not going to get into early detection because I heard it's scary, I don't want to be squeezed, I don't want to do this, then they're not going to do it. But if they go and get an exam that's not scary, that's spa-like, that they actually strangely enjoy, then it encourages them to then get into traditional screening and mammography, because that fear has been eliminated. And therefore, these women who historically have not been getting into early detection are now getting into early detection. And that is the beauty of the work of the Bexa
Okay.
Alliance.
Ooh,
So
ooh, ooh.
good.
Let me chime in here and say on that note, a lot of the reluctance and fear that clinicians have is that it's going to discourage women, right? Because it's going to discourage them from participating in early detection, or it's going to take women away from, and that just hasn't been the case. The women who won't do it, just they haven't. They've had every opportunity, they've had every innovation, it's covered by every insurance, like the opportunities are there. So we're not certainly talking women out of anything, but hopefully helping to demystify that process, helping them to understand why it's important, helping them to understand that, you know, this is breast health. And I think that's the perspective, you know, when you think about your early detection as a healthy measure, as opposed to just screening for cancer, right? Like this is that flip of a switch in your philosophy and in your mindset is something that's very important for people. And it becomes, let me take my health into my own hands and let me take charge of that health, and whatever means I need to do that, whether it's getting my colonoscopy, whether it's getting my GYN checkups, whether it's visiting my dermatologist, you know, getting my breast exams, getting my mammogram. And so it's all part and parcel of that mindset that we really try to deploy. On the question of global and reaching underserved communities, you know, in Colombia, for example, we're partnered with many of the cancer societies to try to influence Bexa into the guidelines, because, you know, these are lower and middle income countries where the average person maybe can't afford to get an exam. And so as we get into more guidelines and as more medical societies are endorsing this, that will help us both abroad and it'll help us here domestically as well, because that is the rate limiting step for so much. So I'll give an example for liquid biopsies like GRAIL. One, they've got to get through their FDA approval, but two, they've got to get into and be covered by CMS, by Medicare, by Medicaid, right? And until those things happen, it's very hard for innovation as a whole to be able to become more available to the general population. So we got some work to do, and sometimes our global work can help inform the stuff in the U.S. We partner with the World Economic Forum, and we sit on that Global Alliance for Women's Health, and so we set the global initiative. It's looking like Kenya and Zambia are the next two countries for breast and cervical cancer. So as the World Economic Forum goes into those countries, we too will go into those countries, and we partner with with organizations like Know Your Lemons, where we're doing community health worker training in Uganda to teach the community health workers how to do a hand breast exam and then how to do a digital breast exam. So there's a lot of global work that's happening right now as well to make sure that we're bringing early detection to the places and spaces that need it the most.
Yeah. So valuable. I think going back to what Tiara said, you're providing a place for not only a platform to get your early detection, but it's in a space that doesn't have fear, like when you go to an exam, like sometimes there's just this fear and anxiety, but the way that it's set up, it allows your guard to be set, let down, and then you're listening, and then you're learning, and you're getting educated, and oh, let me talk to my family about this, where lots of times they're not telling their family history. They're not telling what happened to auntie or to the grandmom, but you're providing this safe space and anxiety-free space that it becomes a course for them, almost like a class for them to learn, and they feel empowered and they can self-advocate, and right, that confidence just continues to grow, and then they do early detection. They actually are okay with it, right? So I heard that loud and clear when you were talking about the individuals coming in, and there's a lot of things that are happening with this new technology, and I applaud you for it. I'm curious what you and both of you, I don't know who wants to take it, but like, where do you see yourselves in the next 10 years, with the Alliance, with the goals, in terms of your impact and growth? Because you're saying you're in demand, and I believe it. Yep.
So I'll start with from the Bexa Equity Alliance standpoint. The goal here is to obviously have every woman to have access to these exams. My goal is to have CMS, just to echo Dr. Mo, we need Medicaid, Medicare to cover these breast exams. That is the ultimate goal here, to advocate and to fight to ensure that no woman is left behind, because that truly is our shared mission with Bexa, and we live by that. And so at the end of the day, for the Bexa Equity Alliance, the most important goal we have is to get Medicaid and Medicare to cover these exams so that all women have access to Bexa and early detection. And especially for those women who, they go to get their mammograms and they are told that they have dense breasts. And their doctor is going to start the conversation of, okay, well, we need to get, you into an additional modality. But women who are underserved, what does that look like? It should be a Bexa. That should be the next step for them. Women who are under 40 that have family history. As you know, I didn't have family history, but women who want to get into early detection, they should be able to have access to a Bexa exam, starting at age 35 at the bare minimum, especially for Black women. So that is the goal of the Bexa Equity Alliance. Every woman to have access.
Ditto. And you raise a really good point. I don't know if I elucidated that earlier, which is that, Bexa is a density independent exam, right? It's the stiffness, not the density. And that's an important fact for young women, because cancer doesn't just start at 40, but the density decreases slightly at 40. That makes a modality that's density dependent more helpful, right? When you look at the screening guidelines, it's a screening guidelines for mammography. It is built around a technology. So my hope is that our screening guidelines would open up a bit, and that we would be able to now say there's more sufficient evidence to support supplemental imaging for women with dense breasts, that there is sufficient evidence to support, starting screening earlier for young women, young Black women who are at higher risk. There is sufficient evidence to suggest that, we now need to offer some sort of technology assisted early detection to pregnant and lactating women who, aren't part of screening protocols, that we could do men who are higher risk where there really isn't a screening protocol. So if you got breast tissue, right? If you're non-binary, whatever, there's an opportunity for you. So I hope it becomes expansive, and that it really opens the hearts and minds of people to the fact that folks do want early detection. And we should have more options in 2024. So that's what's exciting to me. And it's really one of the only things that could get me away from surgery and clinic. And, I love my patients and what I do, but the opportunity to impact a space that hasn't had really much forward movement in over 60 years is something that I'm very passionate about, and making sure that we reach women with a message of breast health. And so partnering with our health systems, absolutely hope to do so. I hope doctors are watching and want to be a part of this and want to do research with us and collaborate, and more to come. You're going to hear a lot more.
Yeah, so good. I know, you're talking about how you align with different companies and hospital partners, and that is the goal, of course, right? And getting this covered by Medicare and Medicaid. Is there an option that you could go in and actually pay for it if you're off the street or you heard this and you just want to come in and pay for it? And what does that cost? I don't know if you're there yet. I'm sorry, but I'm just thinking about all the questions our community would be asking,
It's a good question, but there aren't brick and mortar centers everywhere, right? And so that's the challenging part. There are there's some pilot models of that on the West Coast, and so you could go into a center and you could, purchase an exam for, I don't know, $250, $300, whatever the price is over there. And I'm honestly not certain, but until there are either commercial sites that are offering this, right now, the benefit of it is that you don't have to pay anything for it as long as we go through your insurer and go through your employer, and it's your health benefit. So eventually, I think and I hope that we'll get there, but we're just not there yet.
Yeah. Yeah. Okay. Thank you. We had 2 audience questions, if I can get to those. I know we're closing in on our time here. One is, are Bexa breast exams appropriate for women who actually have breast cancer or they have a bilateral mastectomy with implants?
I love those 2 questions and I'll take them both. Start with the second one first. If you have implants but no mastectomies, like if you just had implant-based augmentation, yes, Bex is for you. If you have a history of cancer, I am of the mindset that you should be under the diagnostic protocol that your doctor recommends. Bex is a screening tool. So people who've had surgeries, mastectomies especially, there's not much breast tissue left there. Less than 2% of the breast tissue is remaining. So, looking at the stiffness of that is not going to be an effective modality for you. So I don't recommend it for people who've had mastectomies. I don't recommend it as a screening tool for people who've had breast cancer because you should be under a diagnostic protocol that your doctor recommends. So some people may opt to do it, especially at our health fairs, but it's not something that I recommend and promote.
Great.
And
Thank you.
first question, did I answer both? I think I got 'em.
Well, with a history of breast cancer, you did. Yeah. Yeah. I
Yeah,
think you did.
talk to your doctor,
Okay.
right? And
Yeah.
we're happy to talk to your doctor for you. So
Yeah.
if you're 20 years out and you had a lumpectomy and you want to get a Bex exam, you may not be in a diagnostic program anymore. And so, we like to know and partner with your health system and make sure that if there are any findings that we're talking to your doctors and we get you into a health system. So in general, it's for screening of the non-affected population. But we do see sometimes people who are many, many years out from their cancer who want additional peace of mind. And, we're here for you too.
Yeah. And I think that sort of answers our second question as well. And this woman was diagnosed. She has chordoma sacrum, a type of bone cancer, and she completed proton therapy July 2024, but it's been 5 years since she had a mammogram and she's overdue. And she's just wondering if Bexa is an option for her.
It could be if we're in a location that's near you or if there's a
Yeah.
BEA event that's near you, that's what I would say. And so for people who are wondering, how can I get this? I would say look to partner, look at our advocacy groups and our partnerships and our calendar of events and places. And we pop up all over the place. We're all over the
Amazing.
country in many cities, many towns, and many more. So, if we can come to you, to your church, to your community program, event, et cetera, then, we certainly will try to do that and try to be where you are. Or if you can come to where we are, we'll definitely try to get you an exam.
Yeah,
Perfect.
and just to kind of echo that, I would just want to share on the Bexa Equity Alliance, all across all of our social media, we always post where we're going to be in the next couple of weeks. So definitely follow us at Bexa Equity Alliance on Instagram and Facebook, LinkedIn as well. And then our website is bexaequityalliance.org. We're always encouraging, corporate donors, individual donors to support our mission so we can be able to serve women in the communities in which, if we want to meet the women where they are. So your request, as long as we have the funding to do it, we will go, and we will go anywhere, literally anywhere. We've done it out of a tent. So you name it, we'll go.
So good. Well, we'll have Rachel put all of those handles in the chat. I was thinking the same. I follow you on social media. It does allow me to see where you are. And even our staff have come to some of your events. And it's really important. And this is just step one of so many steps that you're going to be bringing to us about this new innovation. And if you're following along, then you're going to be able to learn the history and the growth and be able to keep up with it as well. So thank you both. You guys are the best. We love having you on. And I always just feel so much more empowered after listening to the both of you that, we serve thousands at Unite for Her. And the more I can get educated from experts like you, the more I can then get that messaging out so they can get back to you. So we appreciate you being here and being with our community. And thank you for joining our IC experts.
Listen, we're excited. Thank you for having me. We're excited to partner with you. Looking forward to more discussions and being able to bring this to more of your members, hopefully as well too.
Wonderful. Thank you. All right, Erin, there's another one in the books. We're all done.
Amazing. And what a discussion. Like I was just sitting here like taking notes, learning about
Too.
the whole this whole technology is amazing, and it is inspiring to know what we have coming up and what to look forward to in the breast imaging space, and especially for those that don't have access or don't take advantage of things like mammograms. I mean, this is amazing. The work they
Yeah.
do is incredible.
And the complement. We learned so much today, not only the science, the data, what's ahead of us, the complement to the standard of care, the gap, right? The screening gap. I didn't know about that Dr. Mo talked about, right? So now we understand that a little bit better, even for those that are insured. So of course, this is recorded. I will go back and re-listen for sure. And please
Absolutely.
do the same. It will be living on our library.
Yeah.
All right, Erin, we
Wonderful.
have a little bit of what's coming up in November if you want to share that.
Oh, absolutely. We are steamrolling ahead. So we've got our speaker series next Thursday, November 14th, 6 p.m. Eastern Time on Zoom. We'll be joined by Unite for Her provider and licensed professional counselor Cassandra Bolding. Amazing speaker. She's been with us several times already. She's coming back to present on Black women with breast cancer, focusing on societal pressures and stressors. So really interesting topic. Definitely share that with your friends and community. That also will be recorded. So if you're not able to join us, come back to our Her Library and give it a watch. But we are excited to have her back next week. So be on the lookout for our speaker series.
Wonderful. And of course, we want to thank our sponsors. Once again, we can't have these digital education events without them. Our lead sponsors presenting are West, Merck, and Daiichi Sankyo, with additional support from Lilly, GSK, Gilead Sciences, Pfizer, and Immunogen, who is now part of AbbVie. We are most grateful for you, and these are the experts that you help us bring to the table. Thank you.
Thank you.
All right, Erin, that's a wrap. Thank you
Great
for
day.
joining. Yeah, everybody have a great day.
Thank you. Take care.
Bye-bye.